Hi, I'm Tom Faerber. I'm a board-certified oral and maxillofacial surgeon. I've practiced in Overland Park, Kansas for 32 years. And today we have Emery, who we worked on several years ago.
Yeah.
7, 8 years ago?
Yeah, just about.
Okay. So Emery had congenitally missing 8 teeth, and she also had significant atrophy in the bones of her upper and lower jaw. So where you were missing teeth, the bone was significantly reduced in volume. So we went in and did multiple stage procedures. I don't know how much of that you remember or want to remember, but the first surgery was expanding the upper and lower jaw with reconstructed bone grafts into the sinus, but also three-dimensionally building bone out to make room for implants. And then roughly 6 to 9 months later, we placed implants, and then those had to heal. We exposed those implants, and then you went on to have your crowns done.
Yeah.
So how did the process go for you as a teenager with your parents and the concerns, the worries, and the length of treatment?
Yeah. Looking back, it didn't feel very long, but I know when I was in the moment, it was definitely a lengthier process. But throughout all of it, I think one thing that my parents and I really appreciated is just the level of communication and the constant support. I felt like I never had a question that was left unanswered. From pre-op to post-op, everything was treated very well, and I felt like I knew what to do going forward. The healing process was long. There were definitely a lot of days of liquid-only diets, but I made it out on the other side, and more than satisfied with the results. I feel very confident in what I have today, and that's all thanks to your work.
Well, you were fun to work with, but we also know it was a little bit nerve-wracking, worrying about the surgery, the anesthesia, and then the healing process, especially at a stressful time in your life in high school.
Yes.
So we were happy everything went well. Did you have any long-term problems after the surgery or after the crowns were done?
I didn't. It was something where after it was all said and done, there were times where it almost felt like, wow, I haven't been to the dentist. I just go for my regular checkups. This is so unnormal because I was used to the monthly to bi-monthly appointments between you and the other teams that we worked with. But I think, once I graduated high school and went into college and I would meet new people and tell them I was missing that many teeth and that I had that many fake teeth, nobody believed me. I mean, it was kind of a fun party trick to, these are all fake. Because it truly was just a perfect healing journey and just complete satisfaction with it all. So
how was the pain level? Do you remember having just unbearable pain through, because you had some pretty big surgeries, especially the bone grafting to start with.
That was the one that sticks out to me the most in my memory. I just remember it being a longer journey, but through and through, I felt like there was support from your team, and my parents were obviously very involved with it. That was the perk of having it all done at that young age, is I was at home and my parents were there with me every step of the way, so made it through to the other side.
How did your folks, since we had to do a pretty long reconstructive surgery, the first surgery with the invasive issues of the sinus bone grafting, did they feel more comfort with our surgery center status?
Yeah, they definitely did. And I can even say from the patient perspective, going into a hospital setting can be a little nerve-wracking for anyone. So the fact that I was already coming here for my daily appointments and check-ins and working with your team so much, it felt much more safe, and just that I didn't have as many nerves going back into that operation because they were familiar faces and a familiar environment. And I know my parents greatly appreciated that too.
Great. All right. Well, you look fantastic. So
Thank
we're
you.
happy everything has gone well, and I'll check your scan again before you leave today.
Great. Well, thank you. I appreciate everything.
Absolutely. This is a professional case discussion on Emery. Emery, as a 15-year-old patient, was congenitally missing 8 permanent premolars, along with having moderate alveolar bone loss and underdevelopment in these edentulous regions. Since no permanent tooth development had taken place, these regions of missing teeth were associated with significant alveolar bone deficiencies and would require reconstructive bone grafting to allow for the eventual placement of dental implants.
The maxillary edentulous regions were associated with a low maxillary sinus cavity that required augmentation in addition to three-dimensional ridge expansion. The reconstructive bone grafting procedures were completed with the aid of tenting screws, PRF, and bone morphogenic protein growth factors, and this was allowed to heal for 6 months prior to implant placements. 8 implants were placed and allowed to heal for another 4 months, and then these were exposed with second stage exposure surgery and all found to be well integrated. A follow-up examination and CT scan after 8 years reveals excellent bone regeneration and maintenance of excellent bone volume for all the implants involved, and good aesthetics and prosthetic reconstruction.